the chairman of Reform California, the recently woken up Carl DeMaio. Mr. DeMaio, how are you doing this fine morning?
I'm good. I'm up, but I'm not woke. Definitely not woke.
Yes, I should never associate that word with your name. I want to rewind and take that back. Here's Carl DeMaio, everybody. Carl, let's start with the CalCare and AB 1400. Please describe shortly, briefly as you can, and what they are, because I have a lot of questions.
Sure. Basically, the bill, AB 1400, would replace private insurance for healthcare with a strictly government-run, government-controlled, government-managed healthcare program. It would ban private insurance. I mean, and this is important that everyone understand. You will have no choice. You will go to the government doctor, the government healthcare center. You'll get a government X-ray. You'll stand in the government line in order to make appointments. This is an absolute disaster waiting to happen. But worse than that, it's not only harmful to your health, it's harmful to your pocketbook. It would raise taxes so high that we would be more than doubling, almost tripling the tax burden paid in California. They'd raise the income tax, they'd raise a payroll tax, and also California would be the first state to impose statewide an excise tax on all businesses, small and large. And the excise tax is the worst possible tax because it taxes every dollar an organization receives, whether or not you make profit. So you literally can have a mom and pop restaurant that's losing money, or another company losing money, and they would still have to pay an excise tax on the receipts that they collected, even though they didn't make any profit. So this is a bill that would basically create this government healthcare program and take our state budget from $300 billion, which I already think is unsustainable, to nearly $900 billion, nearly $1 trillion in California, literally with a stroke of a pen. This is a disaster. It has to be stopped.
All right, but as I look at my pay stub, so if, all right, granted, those costs are going to go up, but then the biggest item on my deduction list on my pay stub is my health care. So I would get that back, right? So how would that balance out against my increased taxes elsewhere?
Well, okay, so that's a good point, and that's what the Democrats are saying is, it really doesn't cost you any money. Look, I can guarantee you when a Democrat is trying to do tax changes, they will always end up getting more of your money, not less. And so don't be seduced by, you don't have to pay your health care premium. Well, first, you're going to be fired because your business can't afford an excise tax. So they're going to have to cut a bunch of employees and cut costs to pay the government. Second, when you look at your pay stub, your payroll tax will go through the roof. Third, your income tax will go through the roof. And you may not even live to see retirement because you're probably going to get the worst possible health care imaginable. And I'm talking about like Syria level or North Korea level healthcare.
All right. Well, so let me interrupt you, Carl, because the two scariest words in the English language when they're put together are government run, in my opinion. So, look at how the COVID-19 policies, and I mean, does that give you confidence
Exactly.
that?
Ordinarily, Paul, if you and I were having this conversation in 2019 prior to COVID, we'd be bagging on the notion that the same agency or the same group that runs the DMV with its long lines would be in charge of healthcare. And the focus would be that you would never be able to get an appointment. The quality of service would be really bad. Oh, it's worse than that. Can you imagine the government running healthcare and literally being the boss of all the doctors and telling the doctors you're not allowed to advise patients? You're supposed to mandate, don't see them, don't make appointments with them if they don't have a vaccine. This literally, COVID showed, how wrong government got it on COVID. They were wrong on the science. They were wrong on their intervention. And so I don't want them meddling with my healthcare. But secondly, it also shows how vindictive these politicians and government bureaucrats are, that as soon as they decide something needs to happen, by hook or crook, they will mandate, manipulate, force, and cajole you to do it. And so I can see a healthcare system where in the name of wokeness, they say, hey, we're not seeing white patients this week. Sorry, your skin color is not the right tone. We're not going to do that life-saving procedure. You're at the end of the line. They say, hey, we're not seeing white patients this week. Sorry, your skin color is not the right tone. We're not going to do that life-saving procedure. You're at the end of the line. This is insanity. At least when you have your own insurance, you have the ability to go after your insurance company and sue them civilly in court if they don't get it right. But with government, no, that system will be absolutely at their mercy. One final point about the difference between insurance and government. During COVID, the government wasted $30 billion, $30 billion of unemployment funds, our tax dollars, in unemployment fraud scams. An insurance company collects premiums from you and me, and they use those premiums to provide us with our health care. And they are very diligent. They try their best to stop scammers from submitting inappropriate or illegitimate invoices for reimbursement for healthcare expenses. Can you imagine government wasting all those payroll taxes, excise taxes, and income taxes because a bunch of their criminals that they've let out of jail are scamming the healthcare system? Absolutely. They've already done it with unemployment insurance. So I don't want government anywhere near my healthcare. Any sort of government involvement in healthcare has led to higher costs, less quality care. We've got to stop AB 1400.
Carl, we'll have to call it a conversation there. You get the last word, but anybody who wants to learn more or see how they can help out oppose AB 1400, go to Carl's website at reformcalifornia.org. Reformcalifornia.org.
Thanks so much.
All right, go back to bed, Carl. I'll see you when I see you next, okay?
Take care.
All right.
Thanks for watching. Help us break through the censorship of the liberal media by liking this video, sharing it with your friends, and subscribe to my YouTube channel.